Howdy, I'm Dr. Ernie Bowling, Chief Optometric Editor of Optometry Times Magazine. I want to talk for just a moment about an article I recently wrote for the magazine entitled Recent Trends in the Prevalence and Treatment of Ocular Allergy. Allergy is a worldwide problem. Approximately 20% of the world's population suffers from allergies. And of that 20%, up to 60% of that have ocular symptoms. So it's a worldwide problem. Here in the United States, up to 25% of our population, or 85 million Americans, suffer from allergic conjunctivitis or some type of ocular allergy. This presents a tremendous opportunity for us as ODs to care for our patients. And it's also recognized that the number of prescriptions worldwide is raising as well. Prescribing for allergic disease has gone up 20% in the last 15 years. We all see allergic conjunctivitis in our practice. For me, the key is always the itchy, watery eyes. We see these patients come in, rubbing, itchy, runny. The key question is always, does it itch? The old saying, if it doesn't itch, it ain't allergy, is borne out physiologically. Mast cell degranulation causes histamine release, and that produces the itch. So if it ain't itching, probably ain't allergy. And if you think the eyes are red and watery and it is allergy and the patient says no, then you might want to rethink your diagnosis a little bit. Maybe it's something else besides an allergy. I'm asked a lot about subsequent allergy testing. When do I refer a patient to the allergist that I work with here in town for allergic testing? A lot of patients, it's a quality of life issue, really. The allergies they're tremendous allergy sufferers out there, and they really have a hard time with it. So when do I see them? When do I refer them? I like to think of the two R's, recurrent and recalcitrant. If the patient is continually having into my office regularly with allergy problems, then that's a consideration. If the condition just won't go away with my best efforts, then it's probably time to send them to an allergist. Allergists really get into the weeds. It can be very expensive. It can be very time consuming. So that's an issue to consider as well. A lot of things we don't talk about very often, or that we should, is avoidance therapy. It's a hard thing to do, especially if patients got pets and are allergic to their pets, and they're not going to give it their pets. But for other things, if they know something's causing their allergy, then they need to think about getting away from it if they can. We talked about that in another article. Hats out in the wraparound sunglasses is a big one. Long sleeve shirts to keep allergens off the body. Treatment for me is pretty straightforward. I talk about this in the article. For mild cases, it's grandma's home remedies. Artificial tears are a big part of allergy practice. Tears wash away the allergens, dilute the allergens. Cold packs, cold compresses, cold washcloth help give the patient some relief. Also like to keep the non-preserved artificial tears. I like those for allergy patients. That way we don't have any issues with the preservatives in the medications. So I like to keep those in the refrigerator. It acts as a cold compress as well. A lot of good over-the-counter allergy medicines, both topically and orally. Loratadine, Zyrtec, to help our patients with allergies. More severe cases, going to get a prescription medication, antihistamine, mast cell stabilizer, as well as a topical steroid used very few times and for a very, very short period of time. Patients with more severe presentations are going to get a steroid, probably used more often than just a QID dosing. Also, you need to think about these mast cell stabilizers and histamine combinations are also very, very good, very safe. So you can use them more than once or twice a day as been prescribed. I'll step those up sometimes if the patient is really presenting with a problem. So allergies is a real common presentation in an optometric office. Allergy season is rapidly approaching. As long as we know what we're dealing with and the medications available to us, we can make our patients much happier. So are you ready to take care of those red, itchy, watery eyes? Thank you.